Hello, and welcome to POMA Does, a podcast produced by the Pennsylvania Osteopathic Medical Association. We provide a voice for osteopathic medicine and share insights on issues important to osteopathic physicians, residents, and students, as well as those who embrace the osteopathic philosophy. POMA's mission is to promote the distinctive philosophy and practice of osteopathic medicine for our patients, our members, and the communities we serve. Thanks for tuning in.
Thank you so much for joining us. As you both know, in July of this year, the president signed into law the One Big Beautiful Bill Act. This legislation contained numerous provisions that will have significant impacts on our lives for years to come. Joining us today to speak on provisions of the Big Beautiful Bill that will have significant impacts to the future of osteopathic medicine are Jake Brennan, AOA's Associate Director of Congressional Affairs, and Colin Whitney, AOA's Congressional Affairs Associate.
Thanks so much for having us.
Yeah, thanks, Tyler. Happy to be here.
It's great to have you both and looking forward to this discussion. As mentioned, the Big Beautiful Bill contains several provisions that will impact the profession now and aspiring osteopathic physicians in the future. Maybe we start the conversation with provisions you think that will have an immediate impact.
Sure, I can sort of kick off here. I would say basically there's one key provision that's going to have a pretty immediate big impact on physicians, not just within association, but across the country, which is an update to Medicare physician payment. This is something that we have been working on for quite some time, not just the AOA, but all of our partners across the physician community. And we're really proud to have been able to get a 2.5% upward payment adjustment included in the final bill. That is a change from the original bill text, which, had sort of variable increase structure that was paid for in a way that we were a little bit concerned with. And so we're pretty pleased to have this included, and physicians are going to see that take effect January 1st of 2026 when you bill to Medicare. That baseline conversion factor for those services is going to be up about 2.5%. And, although we are really supportive of that particular provision and it's something that we have fought for, we also spent a lot of time trying to ensure that patients continue to have access to care. And there are some really substantial impacts, immediate and long ranging, that this bill is going to have on patient access to care. So particularly within the Medicaid program, we're going to be seeing a lot of changes there too.
Would you mind expanding on some of those changes that are going to affect our patients as we move forward?
Definitely. I think the thing that is going to have the biggest impact is going to be Medicaid work requirements nationwide. So starting at the end of 2026, December 31st, 2026, the vast majority of adults aged 19 to 64, so right in that sort of prime working age population, either need to work or engage in a qualifying activity. So that's, volunteering, that's certain job hunting activities, being engaged in your community in ways that are reportable. And you need to do that at least 80 hours a month to maintain eligibility. And that is going to need to be verified on an ongoing and repeatable basis. And so that is something that's going to end up having quite a bit of impact when paired with overall eligibility determinations. So that's going to begin a day after those work requirements go into effect. So January 1st, 2027, that will require all states to do overall eligibility assessments, basically based on income or disability or, any other way that folks are normally eligible for Medicaid. That is normally something that's checked once a year. This will now be done twice a year. And the administrative cost for that check, as well as the work requirement checks, need to be borne by the state Medicaid in its entirety. So there's no federal assistance for that. We already know that those increased administrative costs have an impact on states' abilities to deliver actual program benefits. We've seen this in a handful of states, particularly Georgia and Tennessee, who've applied for waivers on this in the past. And we, in those states, have also seen quite a lot of folks that would otherwise be eligible and should basically be able to get Medicaid coverage, don't get coverage because they fall off rolls because they aren't doing the eligibility determinations correctly, which obviously has a real impact on folks' ability to receive care. There's also going to be an implementation of new cost sharing provisions, increased baseline cost sharing for most Medicaid beneficiaries. This is going to start in October of 2028. And basically, if you are in that expansion population, so 100% to 130% of the federal poverty line, basically being, just under $21,600, you are going to have to pay up to $35 per service. It usually is some sort of nominal cost sharing in Medicaid, depending on the state, but $35 is by and large for most programs going to be a pretty noticeable increase for folks that are making, not even $22,000 a year. So it's going to have a real impact on beneficiaries' willingness to seek care. And these are particularly, generally speaking, rural and underserved areas where, delays in care may lead to folks ending up in the hospital or ending up with exacerbated chronic diseases that end up costing more money to the state programs, as well as end up being more complex for physicians to deal with. So that's something that we're really trying to keep an eye on as this is implemented.
Jake, thank you so much for expanding on all of that and the future impacts that we're going to see from this legislation. Colin, I want to now turn to you and talk about what's going to impact our aspiring osteopathic physicians.
Yeah, happy to jump in. We got a lot of provisions in there that are affecting current borrowers who are attending school, as well as those who are out of school, and then, of course, those aspiring osteopathic physicians. I'll start off with things for our aspiring physicians. Beginning on July of 2026, there's going to be a new cap on student loans that will be implemented. This will place substantial limitations on the borrowing amount for certain types of loans that are really important for our osteopathic medical students. To start off, we've got direct unsubsidized loans. That includes medical students needing federal tuition assistance must now rely on these loans subject to an annual limit of $50,000 and a lifetime cap of $200,000. I would note that the median cost of attending medical school is over $200,000, which means that, students are going to have to be looking to other places in order to get the financial assistance that they need to attend osteopathic medical school. The other thing that's different with these direct unsubsidized loans versus subsidized loans is that they start accruing interest from the date that they are dispersed. So even if you're still in school, those loans are going to start accruing interest the day that you receive them. Next up, we have our Graduate Plus loans, which were a tool that was used by a lot of osteopathic medical students to help with tuition assistance. Those are being eliminated entirely for new borrowers beginning on July 1st, 2026. Current borrowers, so people already receiving Graduate Plus loans, will be able to continue to access them. But again, any new loans starting July 1st, 2026 will not be dispersed. And then we also have our Parent Plus loans, which are another tool that are utilized by a lot of students and aspiring osteopathic physicians. This now is going to be restricted to $20,000 a year with a $65,000 total cap. And these loans will no longer be eligible for any income-driven repayment option or forgiveness option, which is a pretty key thing there. And as I'm talking about repayment, that's probably the biggest second thing on the student loan front that the big, beautiful bill, had changes to. First off, we've got, again, this implementation date of July 1st, 2026. Most income-driven repayment plans are going to be phased out for all borrowers. That includes the pay-as-you-earn plan, income-based repayment, and income contingent repayment. And I just want to make sure I note for those who are currently participating in the SAVE plan, interest accrual restarted on August 1st of this year. So in case you hadn't noticed, I'm sure people are on top of that, but interest accrual did restart there on August 1st. As we get into sort of this new repayment structure that is built out within this bill, there's going to be basically two options for borrowers in their repayment. And that includes for current borrowers and future borrowers are going to need to switch to a modified income-based repayment plan or the new repayment assistant plan by July of 2028. And then new borrowers are going to have the option of choosing between those two plans as their loans are dispersed. So beginning July 2026 for them is when they'll have to make that decision, that same implementation date that we're looking at with all these changes to the student loan system. The standard repayment plan varies from 10 to 25 years, depending on how much you borrowed with fixed payments. And then the repayment assistant plan has payments of 1 to 10% of your income with forgiveness after 30 years. And another key thing that I want to note for everyone is that deferment options are being adjusted as well. Within this bill, it's eliminated the ability to defer payments due to economic hardship or unemployment and limits forbearances to a total of 9 months within a 24-month period. So that forbearance period is when you're not required to make payments on your loan, but they're looking to sort of restrict that following having longer forbearance periods that have gone on for the state plan and others, as there have been challenges to the legality of those programs.
Colin, thank you so much for all of that information. As attending medical school is complicated and attaining the finances to do so is an already complicated process. With the law changing out from under us, we very much appreciate this information. Jake, I want to throw it back to you. With all the changes in the state Medicaid programs, have you seen studies on how this would impact those in those Medicaid programs?
The Congressional Budget Office actually just issued an updated report on a number of provisions in this bill a couple of weeks ago that sort of focused on the Medicaid, Medicare, and ACA coverage changes. And, this sort of projection of coverage change in particular has been a bit of a moving target. Their sort of most recent final number is that over the next 8 years, about 10 million more Americans will become uninsured as a result of the provisions in this bill. And 3/4 of those coverage losses are for Medicaid alone. So, it's a pretty substantial impact to the Medicaid population. And it's sort of exacerbated by the fact that the premium tax credits for the ACA are not extended either. So that's sort of where a lot of these folks that would typically sort of get disenrolled for a number of reasons would kind of have a landing zone, is in that ACA marketplace. And without the premium tax credit, those marketplaces are going to become more and more difficult for those folks to get access to. The CBO estimates that there are going to be, nearly 1 million Americans who would otherwise be eligible for Medicaid, who will be basically inadvertently disenrolled as a result of more frequent eligibility determinations and folks' sort of inability to keep up with the paperwork and other stuff that's necessary. So these are folks that, meet every requirement, are, meeting new work requirements, are doing all the right things, but just can't keep up with the paperwork and lose coverage as a result. So 1 million people in that category, are close to a bit more than 800,000, if I recall. That's a real impact nationwide. And, this is going to have an impact on not just folks in Medicaid, but is going to have a real impact on physicians as well, particularly those in more rural and underserved areas where you've got a bit of a disproportionate Medicare, Medicaid, ACA exchange payer mix. Because if you are disproportionately impacted by these disenrollments, regionally speaking, you as a physician, especially someone in independent private practice or somebody working at a rural hospital that's teetering on that edge anyway, you're going to likely face a real increase in uncompensated care, undercompensated care for people in vulnerable populations. And so, that's something that we are really concerned about. I know that this is something that folks in the Senate in particular brought up as concerns as this bill is being debated about the impact on rural hospitals and rural physicians in particular. And I think that this is something that we are going to be really, especially given the osteopathic profession's skew towards rural areas, going to be having to keep an eye on, because these are the areas that are going to be hardest hit by disenrollment from Medicaid and potential increases in uncompensated care.
Absolutely. And hopefully as action is taken at the federal level, we can have future conversations to update our members on that. I do want to thank both of you for joining us today on this very important subject. And as we've pointed out, there are many deadlines still to come for the big, beautiful bill. December 31st of 2026 and then January 1st of 2027 are the big ones for the patient populations. And then we have the July 2028 and July 2026 deadlines for the students as well. So lots of dates flying out there. And so thank you both for helping to make sense of that for our members. And if anything ever comes up, feel free to let us know and we'll have you back.
Sounds good. Happy to come on anytime. Thanks so much for having us.
Thank you for joining us for this edition of POMA Does. Be sure to subscribe to POMA Does wherever you listen to your podcasts, and tell your friends and colleagues to tune in. Learn more about osteopathic medicine and POMA on our webpage, www.poma.org, and join the conversation on social media. We're on Facebook, Instagram, LinkedIn, Twitter, and YouTube. Or email us at poma@poma.org. We'd love to hear from you. Join us next time for another edition of POMA Does.